The main problem from my standpoint is that our healthcare system is not integrated enough. There's all these patchwork and competing interests. You've got the insurance industry, pharmaceutical industry, primary care versus specialty care. And when you have that lack of integration, your administrative costs go up.
Right.
And that costs the whole system. So it's more than just let's insure X number of people. We have to look at how we're going to integrate our system better so that we can more effectively take care of these patients that have chronic disease. If we don't do that, all we're going to be doing is taking care of more people with more chronic disease, and our costs are going to go up. The large majority of patients that have chronic disease are what costs the system the most money, which makes sense. I mean, I was always acutely aware of the uninsured, especially even working in the emergency room. You'd have patients with high blood pressure, diabetes, who would be better managed in an outpatient setting, but they're coming to the emergency room because they don't have a primary care physician. It takes a lot more work to take care of a patient that has a chronic disease. And, if you come in for knee pain, you're treated for it, it gets better. That may be a couple of visits, whereas when you have a large population that has chronic diseases, you're looking at least 3 to 4 visits per year. So I think we're focusing so much more on, who's going to get the coverage and who the sources of the coverage is going to be, which is an important question, but we still have to look at how we're going to integrate the system. I think in the younger generation, there is much more of a willingness to try to come up with a plan to cover everyone. But I think there's still that old debate on the best way to do it. Is it better to have the government provide that care or the private sector? I think that argument is just as robust among my age group and my generation of physicians as the older generation of physicians. Because sometimes when I watch the debate, to be honest, I'm like yelling at the TV because I'm like, there's critical elements that are missing. Like if you look at the major talking points for healthcare reform, there's very little said about the need for primary care physicians in our country. Think about it. How often have you heard that? And that is critical because just because you insure someone, you've got to have the physicians to take care of those patients. From my perspective, in terms of how I feel it's going to affect my patients, on the one hand, I think it will create access for certain patients, but I think on the other hand, it may create problems in terms of, from a primary care standpoint, of actually providing care for those patients. So in other words, it'll establish insurance access, but it may not establish primary care access.
Right.
And a part of the reason that is because we have fewer primary care physicians than we used to. We have fewer trainees going into primary care. So one of my big issues is as we're discussing this issue and we talk about improving access and insuring individuals, have we really thought about providing an infrastructure for those patients to be even cared for properly?
Right.